Now we're going to inject the cheeks, because the middle of the cheeks, what we call the apple of the cheeks in this face, is lacking the volume. So we have good curve on this side with a good projection on this side, but there's like a triangle which is missing. So if we give it a little bit of volume to restore the volume of the mid cheek, and it will give a nicer look. So I can visualize the depression of the mid cheek, which is nearly here. Same on the other side, which I can see right from top. Here it is. I will be using hyaluronic acid. That is a bit strong enough to give the volume of the mid cheek, to give it the roundness that is missing.
So I usually prefer to do the injection from the side because I can see the projection, how far it goes. So we're gonna start the injection. That's gonna hurt a little bit on me. I have to go deep and start injecting. My injection is always retrograde and in lines, in and out. Are you okay? In and out, in and out. And the triangle is guiding me. I stop from this angle. I already can see the projection. I just need to start from the lower angle of my triangle and go all the way deep. The volume has immediately got restored. We still can go for more, but we always go for the natural look. So we can see it from top now. The depression has gone. I usually massage a bit just to redistribute the filler in its place. Now if you smile, you can see how the volume has been restored, and it's yet not that big. But if we put more of the filler, again it might look nicer, but when you smile it will give you even more volume, because the muscle will lift up the whole quantity of volume of filler. Okay, now relax again. Now I can still see some areas with lack of volume, and clearly it's this triangle which we call it the marionette line, and usually it's created because of the descendants of the cheek due to gravity, aging, and so many other factors, plus that there's a ligament here that holds this part from falling with the rest of the face. So that's why we can see this and then this. The other line, which is not that deep compared to this, is the nasolabial fold. So as far as we're gonna fill this, it will give automatically the image of lift. The injection again comes from the side, so that I can visualize the increase in the volume. And I go retrograde again. Already I can see the increase in volume here. So now it lifts with a smaller triangle. You're okay? And I go up I'm gonna change the needle. I want to load it with filler. Just a tiny bit here. And we're done. We continue with the nasolabial fold, which is less deep. And again, I go from one side. And again, I try not to go very deep here. And very simple. Now we can compare the two areas. I also like to massage it so that it will stay in the sulcus, means the depressed part. Alright, so the right face has been already filled. You okay? Here it is. Again, we have a depression here, just at the back of this fullness and just in the middle of the cheek. So again, it's a triangle. The other triangle that needs to be filled is the nasolabial fold. And the third triangle is the depression of the marionette line. If we try to fill in these triangles, we give an indirect, or we give a camouflage, as if the face has been lifted up. So that's exactly what I want to do with this hollow. If I do the filling, it's going to get filled exactly this way, not more. I'm going to get into this triangle from two axes, a retrograde from this side, and again a retrograde from this side. So I go deep and I come out, and again in lines. I change the axis, and again retrograde. And that's it. The volume has been restored, and I repeat, I can still keep more, but that just give it a fullness of the depth. Voila, done. Then a little massage. So we still have these two lines, the marionette line from the side, and I go injecting, and it gives the projection where it asks me to stop. So it's already projected. And massage it against the bone to give a smoother effect. The last triangle. And the last here. Same for the nasolabial fold. I go for the first triangle, second, And lastly, the third. Okay, so we're done with the mid of the mid cheek, nasolabial fold, and marionette lines. This would actually give a camouflage as if the face has been lifted up. I like the results simply because it gives you a very natural effect. As I said, we still can do more, but more means not natural.